Great. Well, aloha everybody and welcome to the first quarter Regional Community Coalition quarterly meeting for all of the members. We're thrilled that you've all come to attend this meeting. We'll spend a little bit of time talking about where we're at today. And then from there, we have a few presentations. They look terrific, amazing. So we're really excited about that. And so we'll just get started and let it roll right out here then. So a little housekeeping for everybody. Any questions, please enter them into the chat box or speak up. You can mute your microphones during the presentation. And we're really looking for an interactive session today where we'd be able to have the opportunity to hear from you and listen to the discussion and have you lead as much of the discussion as possible. This is our quarter one meeting. Quarter two will take place on April 27th. There will be a time change based on the daylight savings for Hawaii and Guam, it looks like, but for everyone else, be about the same time except for Alaska too. We have an agenda today. We're happy to have our Chief Executive Officer, Sarah Medley, with us today. She'll be talking a little bit about Mountain Pacific leadership. Caitlin Conway and Kyla Newland and Ms. Sai will all be talking about immunizations. We also want to let everybody know that Jessica Lystra is working in the Alaska here for Mountain Pacific as part of the Alaska coalitions there. Dave will be giving a presentation. Our Guam team will be giving a presentation. We'll talk a little bit about the training series. Then we'll have time for questions and answers, and we'll talk about the next call. So to get us started today, I'd like to introduce our CEO from Mountain Pacific, Sarah Medley, wants to talk a little bit about some immunizations, vaccinations.
So much, Mark, and welcome everyone. It's excited to see some faces on the screen, some familiar and some not so much, but hoping over the next year we get to see more of you. So one of the messages, of course, that's top of mind for all of us is the COVID vaccine. And we are, among other organizations around the nation, going to be able to promote the vaccine and support some of the efforts that some organizations are having in administering that vaccine. So I want to make sure that you know CMS is really positioning us to do that so that we can better fully support those vaccine efforts. And if you would like, you can certainly use these coalitions as a venue to do planning or any of your outreach, as it were. So you have contacts of Mountain Pacific staff, so be sure and reach out to them. And again, thank you so much for all you do for those we serve. Thanks so much, Mark.
Oh, mahalo, Sarah. Thank you very much. Okay, well, let's move into immunizations then. Caitlin, Stevie, Kyla.
Thanks, Mark. We just wanted to also add on to what Sarah was sharing with you all, that we're here to support you in any way that we can. And so that goes for not only the COVID-19 vaccine, but also for pneumonia and for the flu. So no, we're here to support, and that we're excited that we can provide that moving forward. We have one question, and like Mark said, we really want this to be interactive as we work with you today. So feel free to unmute yourself and answer. And so on the next slide, I just wanted to ask you, what are the biggest gaps, barriers, or the challenges you're encountering with the COVID-19 vaccine rollout? So feel free to drop some chat, come off mute. We just want to hear from you so that we can better position ourselves to help you moving forward. And don't be shy. Great, exactly, Sarah. We're seeing that in a lot of places, right? The demand is far exceeding the supply. Yep, getting 50% of, only 50% of the plays are taking it. So that's another great area. Yep, looking at that vaccine hesitancy among healthcare workers and our general public. Very good. Oh, Mary, good. Transportation, right? That's huge. I know that that's been in my community as well, and making sure our elders had someone to go with them, take them, sit there through all of that. So that's been a huge component. So great, great. Glad you're bringing that up. Yes, what phase are we in? I'm sure you all, as I do, I feel daily, somebody's like, what are we on? When do I get to go? Who do I call? And I'm like, well, I don't know all those answers, but we're there to support each other and help figure that out. That's great. IT challenges. Yes, yes. Some places are only utilizing, you know, an application or an online platform. And it's definitely like first come, first serve. And so if you don't even know how to use that, that's definitely going to stifle some of those being having that opportunity. Staffing, for sure. I've heard staffing a lot. Unfortunately, we can't staff for you guys, but we can help look at those workflows and those processes to help improve there, because that's a really great point. Good. Yep, how to sign up, funding, confusion on the payment side of things. Absolutely, the side effects as well. So looking at those. So there's a lot of education materials out there, but making sure people have access to those. And then also the other, like myth busting and things like that, right? Because there's a lot of that going on too, where there's conflicting messages out there, and where and what do I read? Right, I'm with Sarah. I was assuming it was free, but that's a good. Do you have your insurance card? What do you do? You know, just still talking through those so people aren't worried as a barrier to getting that. So very good.
Caitlin, I had a question yesterday that I checked on, and it was based on the fact that a lot of people at the DMV are in waiting lines to renew their license and they're expired. Would that expired ID still work to get a vaccination? And so I called the Queens Hub here in Hawaii, and they said they would accept it if the information on the card, that expired card, was current. So I thought that was a really good question I got asked yesterday. So
yeah, great question. Yeah, one we went thought of. Absolutely. Really good, Mark. This is all great. Great feedback, everyone. This really gives us good information for where we need to go to support you. So good. So keep those coming. If anything else, feel free to chat it in throughout the end. We do have a couple polling questions to help us, but those will be later on. So I will pass it back to you, Mark.
Terrific. So nursing home updates. We did want to just go over the different goals that we're looking at today. Behavioral health, which includes opioids, patient safety, chronic disease self-management, the quality of care transitions. We're getting a lot of information on that, particularly in nursing homes, as outbreaks in acute care settings, and then transferring people back to skilled nursing facilities. These are all issues that we're currently working on through coalition work, and then to improve nursing home quality also. We have some great, powerful partners today to work with. And the first one that's up is Dave Wanzenried. And Dave has come up with a guidebook for medication management and safety. So Dave, go ahead and take it away and let me know when you want to go to your book itself.
Thank you, Mark. I really appreciate the opportunity to present. I want to represent this as a collaborative project, not mine by any means. All of you folks that are on the line here know how busy everyone is now, especially because of COVID-19. People had hectic schedules before, they're on steroids now. And for me, the challenge has been to get people within my coalition to identify as coalition members and to have some sort of reason to participate other than just dialing in each month. So the reason I put this timeline up in front of you is to show you just how quickly I was able to steal really some time from all the people that were involved in generating this guidebook. It first came up in August at our meeting in August, one of my friends, Carla Cobb, made a presentation about just how much cost are incurred by readmissions to hospital just because people don't properly medicate, and all the other statistics that go along with that. Well, the response was very overwhelming on the part of the participants on that call. And so within a short period of time, as you can see, on August 20th to 30th, we had a working draft of just the people that contacted me. And I put together a small working group. And throughout the month of really October into November, refined a working draft into something that was pretty much a finished document. And all of you will have a chance to look at it. But the process that we went through, I think, is more important than the document itself, because it really engendered some ownership on the part of participants in a way that nothing else I had done did. All the participants, in one way or another, at that meeting took time out of their schedules to make feedback. They really provide meaningful feedback. And we're talking about people that are physicians, pharmacists, home care managers, nursing home administrators, hospital employees, across the gamut. People involved in hospice even took time out of their schedules to assist in refining this document. That was a helpful exercise for the coalition itself, but then at that point, Pacific became an important partner in this process, because I don't have the skills to make a finished product and make it look professional and make it look appealing. So I sent a copy of that to Caitlin Conwell and to Alona, and they in turn sent it to their communications team, and the communications team turned that document around between really Thanksgiving and the first week in January. So from the time that we started this project in late August of 2020 and had a finished product really that we'll show you here in just a minute, about 135 days, which is remarkable. And I want to emphasize, I'd like all of you to take a look at this when you have time and provide me with feedback about its use. It is written so that it's generic. It doesn't just apply to here in Billings or in Montana. It's good from Great Falls to Guam and from Anacortes, Washington to Anchorage, Alaska. It works anywhere. And the reason I want to emphasize the collaboration is I really think that that's key for moving people off of a preoccupation with COVID-19. Obviously, with the vaccine, we're making some headway, but I want to just encourage all of you to look at it, and the feedback that you can provide me will make the document even better. It's been vetted pretty broadly, and thanks to all the people here in Billings and in South Central Montana, and really across Montana and Wyoming, we ended up with a really good document. And if you could just go to that slide that has the link, Mark, that's the link right there. And if you will take a few minutes, I don't know if you can open it or not, Mark, but there's nothing magical about this booklet. But right after the meeting, I did a survey of the literature online and found that there's very few documents available at all about medication management and safety that really speak to the patients themselves or clients, or speak at the level that people can understand that are older adults, caregivers, and the rest. And so we took a document that was really a slapdash on my part to put something together to kind of capture that energy that everyone had expressed an interest in, and put together a first-rate document. And I want to ask all of you again to take a look at it when you have some time and provide some feedback. I want to emphasize it's a collaborative project. And now I think for the first time, there's energy about what we can do more as a group than we can individually. My fourth grade teacher once told me, don't confuse activity with achievement. And thanks to the good work of a lot of people that work pretty hard at this, we've got a document that's now in front of you here. And if you just scroll down to the table of contents, Mark, I think it's the third, if you can do that.
Yep, I should be able to do that here. Hold on.
If you can, fine. I'm glad you're trying to do it, not me, because I know I can't.
Right there.
There it is. here's just an idea of how it's organized, and it's written, it's in large font, and if you open it up, you'll see that it's 29 pages long. And a lot of people said, my God, that's way too long. My patients will never use that. The people in home care, they'll never look at this. And we set it up so you can print individual sections of that document. And it's in large font. If you'll scroll down just a few more slides, Mark, I'll just show people. You can see here, it's in a large font. One would be there. When you print that, that'll be in a large enough font for someone to read very easily. And if the feedback is it's not large enough or it's too large, but that accounts for the large reason that the document is as long as it is. And we here in Billings now are talking about doing some more work on care transitions. And we want to produce something similar to this that's a useful document for all the players that are involved from the time someone is discharged from the hospital or discharged from any kind of care into a different environment. So that medication management is one part of that, but there are thousands of other things that a lot of people have been talking about. So this project has really served as a catalyst to focus people's attention on being able to do more together than we can do individually. And with that, I will be happy to answer any questions.
I don't have a question, but I do, Dave did such a good job of thanking all of us and our communications, but we also want to extend that back to you, Dave. You did a wonderful job with this and the coalition members, and we're just so thankful for all the hard work that you've all put into this. So thank you.
Well, we can get more to work by working together, and especially with the work that you folks did to make it look so nice, Caitlin. It was pretty easy on my part to get it done. So thank you all for your time, and thanks for the opportunity to present.
Terrific. So let's get back over here to our powerful partners. And we have our Guam team on today. We're really happy that they're here to present, and very excited that Agnes and Linus and Gina are all here to talk about their Diabetes Coalition and their patient and family activity work.
Hey, good morning, good afternoon, and half a day. Hello to everyone. I'm Glynis Almonte, a member of the Guam team. With me is Agnes White, and we're excited to present to you the Guam Diabetes Control Coalition. So Aggie will briefly talk about our small, beautiful paradise island of Guam.
So this is a question everyone asks: where is Guam? When I went to college in the Midwest, someone asked me, "Is that off the coast of Florida?" I said, "Dude, you got the wrong ocean. We are in the Pacific." So this is the map. We're in the Pacific Ocean. Hawaii is way to the right, and we are closer to Asia. There we are, right there. West of us is Philippines, and north of us is Japan. So we got our bearings, and mainland China is way over here. So we are really way far away from the U.S. mainland. And many of you who have come here realize that real quick. It's a 7-hour ride from Hawaii to Guam. And you cross the international date line as well. Okay, so we are the largest island, actually, of the Marianas chain at 212 square miles. So we are the largest. That's our claim to fame. So that's where we are. So we all get our bearings. Can I have the next slide? Here's some scenes from our island that I took. That's the big one over there. That's my paddling team. Some of these I took when we were hiking. The southernmost, if you look at the bottom left, that's a view of the southernmost island. And so these are just a few sunset pictures, and you know, the beach is everywhere and very accessible. Okay, we can go to the next slide.
Okay, so that's back to me. So welcome to our Guam Diabetes Control Coalition. And next slide, Mark, please. Okay, so this is our logo. Okay, so GDCC was established in January 21, 2009, according to our bylaws. That GDCC logo was created in 2016 by members of GDCC. The blue circle was taken from the World Diabetes Day logo, and we added the lattice stone artwork. The lattice stone is a key symbol in expressions of the contemporary Chamorro identity. Chamorros is how people from Guam are called, the Chamorros. So they're the indigenous people of Guam. And okay, next slide, please.
Well, Gladys, I wanted to add that Gina was the one that designed that logo
Oh,
as
yes.
well. Yes,
So
well,
Gina was started that when she was still working with us with Mountain Pacific. So we started that. Okay, now GDCC's vision is this: the people of Guam will be diabetes-free, embracing a healthy lifestyle and living in a healthy environment. Guam has a very high incidence of diabetes. And our vision, the people of Guam will be, oh, that's the same one that I said. Okay, next one. And our mission is to reduce diabetes incidence and mortality in Guam through the collaborative efforts of public and private stakeholders. Okay. Next slide, please. So this is the composition of our coalition. So we have a chairperson and a vice chairperson. Our chairperson right now is Dr. Keith Horinucci, and our vice chairperson is no other than Agnes White. And the chairperson is elected for 1 year. The vice chair usually serves for 2 years as the vice chair, and then the second year will be chairperson. So Aggie will be the chairperson this coming May. And the other members are representatives from different organizations and independent individuals concerned with the diabetes prevention and control. Okay. So next slide, please. So these are the coalition members according to our bylaws. So you will see that our membership does not only include clinical people, but also non-clinical, such as the government officials, the Department of Education, the schools, and the universities. And then we have the different organizations like the GNA, GMS, the doctor organizations. We also have members from the Guam Rotary Clubs and Lions Clubs who participate in our activities pre-COVID and also at this time. Okay. If you notice this diabetes promotora, actually promotora, okay, a diabetes promotora is a person with diabetes representing the general public. This person is a private citizen not associated with the other stakeholders in the coalition. Okay. And I would like to mention that the Department of Public Health and Social Services Diabetes Control Program plays a vital role in our coalition work. The program provides operational and technical support, such as coordinating the meetings, notifying the members of the meeting dates, taking minutes of the meetings. And Mr. Patrick Lucis, who chairs this program at Public Health, is the person who has been helping us throughout the years, along with his staff. But since COVID hit Guam and all over the world, the person from his department has been reassigned to the COVID activities. So we're just working whatever we can. Okay, next slide, please. So this is a picture during an awarding of certificates of appreciation to some of our coalition members for their contribution to the coalition work. So in these photos, we have doctors. All the gentlemen are doctors except Patrick, the one closest to me. So Patrick Lucis is the head of the diabetes prevention program of public health. And then the three ladies are our certified diabetes educator, Aggie, Anna, Milay. Then the other lady is with public health as well. So we don't have a lot of pictures. Actually, we do have, but I cannot dig everything from my phone. Okay. Okay, next slide, please. Now I will turn over the presentation to Aggie again.
So if in the previous slides, you saw that we are, the composition of our coalition comes from many entities in our community. So we divided the coalition into subcommittees, data, advocacy and policy, prevention and health promotion, and clinical. Glynis and I are in the clinical section. And within each of these subcommittees, we all have our roles and our goals that we have penned and put together. And so we feel this is the better way to, address diabetes issues here on the island. And at every meeting, each of these committees just gives a brief report. And separately, they do meet to tackle issues. Okay, next slide, please. Okay, so we worked on a 2016 to 2020 strategic plan for the island. And we were supposed to evaluate it last year, but that's a big blur to everyone. So this was our mission, vision, and our ultimate goal, which we learned was very lofty. We learned lots of things doing this and making SMART goals. Alana, we wish we had that session with you way back in 2016 or 2015 when we penned some of this. But we're learning. Next slide, please. And this is the actual paper copy, which we took a photo. Public health is the one that funds some of the stuff we do, the venue, and as well as the publication of our materials. So each team subcommittee had an ultimate goal. The ultimate goal was to reduce diabetes and prevalence and mortality by 20%. We still have to have a meeting to talk about, to evaluate this plan, as well as start the next 5-year plan as well. So these were some of our goals. Each of the committees had some goals. And like I said, we learned a lot about SMART goals, didn't we, Glynis? Okay, next slide, please. And this was we had to do a 4-year evaluation so that the last year of our plan, we can really tackle, doable actions and doable issues. So this was done in December of 2019, getting ready for the last year of our plan. And we all know what happened. So many of our intentions were side railed or put to a halt. May I have the next slide, please? There's Gina, the first one there. And this is the group that got together at that session in December. Okie doke. Next one, Mark. Okay, so this is the future plans for, at least for the Diabetes Coalition, regarding our strategic plan. Like I said, is to evaluate the current one, or the 2016 to 2020, and work on the 2021 to 2025. I know our committee has been working on that. We started doing that, and we hope to have something more realistic soon. Okay, Guy, you're on next.
Okay, so here are the events that happened pre-COVID-19. So throughout the years, we've been participating with health fairs in the community, in the malls, in the big groceries, outreaches. We also went to the different villages, and we have the annual diabetes conference sponsored by the Guam Diabetes Association, who is a big member of GDCC. And every November, we have big annual conference. We invited off-island speakers, and the people who attended those was like about 1,000 people. So one session in the morning, and then it was repeated in the afternoon. It was people from Guam, especially the elderly, they wanted to attend. And we also provided continuing education credits coming from the Guam Nurses Association, who is a co-partner of GDA during this annual conference. Then we also had Diabetes Alert Day activities, which was in the month of March. So same thing, we did have health fairs at the malls. Another activity that we started was the Fun in the Sun. Actually, this Fun in the Sun outdoor activity for children was started by us, Mountain Pacific, with me, Aggie, and Gina. And then later on, it was taken over by GDCC and the Department of Education, who's a member of the prevention subcommittee of GDCC, took over this activity for the children. And it usually happened in the month of November also, coincides with the diabetes conference. Okay. We also had the Department of Education teachers training on diabetes care. Part of the funding came from the Guam Diabetes Association because GDA has the money, GDCC, we don't have the money. So we rely on GDA.
We don't have any money.
We don't have any money. So we had, I think, 2 cohorts already. Teachers were on training. And then we also developed the Guam Diabetes Resource Guide. So we collected the organizations, their phone numbers, their addresses, and put it in one guide to give to that takes care of diabetes or deals with diabetes education and prevention. And so we finalized it already. And GDCC also supported bills related to diabetes. So we have some bills that became into law already that talks about diabetes. And GDCC provided testimony on those bills. Next slide, please. Now, during the COVID-19 pandemic, so COVID-19 did not prevent us from holding these activities, especially the diabetes conference. The GDA board said, no, let's not have a conference, but I insisted on having that. So Winnie Butler, who's the executive director, said, but who's gonna do it? So I said, okay, I will do it. Me, Aggie, Patrick. So those people who are a little bit techie. But thanks to Mountain Pacific for really helping us plan that. And so we have the very successful first virtual diabetes conference in November of 14 of last year. We also guested in local radio, TV show, KUAM. This is a local TV show in Guam, the Link, to talk about diabetes self-management. I think we got in there 2 or 3 times. We developed diabetes flyers in coordination with public health about diabetes education and prevention, especially during the pandemic. And these flyers were shown in the television, the channels here, and our GDCC Facebook. Yes, we do have a Facebook page. Another big achievement was the procurement of donation of 100 CGMs from Abbott Labs for hospital use and later on used in the clinics. We gave it to some of our partners in the clinics because the CGMs had an expiration of September last year, and then I think we got it only like in
May.
July, August. And so GMATs was we intended it to give to GMATs. We gave it to them, but then they were not able to use it, all of it. So it was, some of it were given to the clinics and GRMC, the other private hospital. So I'd like to commend Dr. Mila Young, who's a member of our GDCC coalition, who spearheaded this project. And then we did surveys on the Guam villages' healthcare needs related to chronic diseases, especially diabetes. So Aggie and I called the different mayors of the villages and we asked them about what are your healthcare needs? How do you want education to be given to your constituents? And thank you to Mary Erickson for helping us develop the survey form. So we haven't had the chance to go back to the mayors to continue this program. So hopefully this year we can.
Well, COVID-19 put a hold on all that. They
Yes.
wanted face-to-face classes, etc., and screenings, and so that's on
Okay.
hold.
Next slide, please, Mark. So this is our 21st Annual Diabetes Conference. And like I said earlier, it was very successful. The conference was attended by 130 plus from all over, a lot of people from Guam, of course. And we had 3 local presenters during that time. So people ask, can we do it again? So we're gonna plan for sure. Thank you. Next slide.
Terrific. Thank you so much.
Yeah. Now, before you go, before we all go, actually we have some more in there. I would like to introduce to you one of our coalition members to give her story about her coalition experience. Kathy Castro is a pro in volunteer work in our community. He's a member of Cancer Coalition, Diabetes Coalition, the Non-Communicable Disease Consortium, the Tobacco Cessation Program of Public Health, the Archdiocese of Guam helping the church. She's the GDCC, our coalition chairperson of the Advocacy and Policy Committee. And she's also a member of our newest group, the PFAC. So Kathy Castro, welcome.
Thank you, Glynis. Half a day, everyone. I'm Kathy Rivera Castro, and as Glynis said, I am a community advocate that volunteers my time to lots of different organizations on the island in the hopes of ensuring that our people have just access to care and improving their quality of life. Full disclosure, I also lead the COVID pandemic response task force for the Archdiocese of Agana. Guam has a population of about 160,000 people, where 80% are Catholic. So I lead the task force and coordinate and work side by side with the Department of Public Health and Social Services with regards to the pandemic response. I'm a new member of the Diabetes Coalition on Guam. I became a member in January. They had been asking me to come on board, and my plate was just a bit full. And I said, as soon as I can give up some chairmanships, I'll come on board. And so in January of last year, I joined the coalition, and before I knew it, I was leading the policy and advocacy team. So I got my feet wet. I work very closely with our government counterparts and our senators in the legislature in pushing policies regarding healthcare. So I saw someone posing a question on how we get information, or how do we get access to what bills are coming on board. As I said, I work very closely with our policymakers and our government counterparts. And whenever there is a bill or an intended bill being pushed by one of the senators or one of our doctors, usually I get wind of it. They'll call me and ask me my thoughts, and then I kind of route it to the prospective coalitions, whether it be the diabetes, the cancer, the tobacco. So that's basically how we get wind of it. Or sometimes we have issues that we'd like to pursue, and I take it to a senator in hopes of getting someone to sponsor legislation on it. In regards to my involvement with the coalition, I just needed to share, as I said, I'm involved in I lead the task force for the Archdiocese. And interestingly enough, when COVID hit, I knew very little about the disease of diabetes, but when I came on board, boy, let me tell you, just the first 2 months, I was able to learn more than I had imagined to learn. And in the process of doing that, it began to not only educate me, but I was able to pass that information on to many of our people through the archdiocese, through the churches, and also share whatever resources and information that the coalition has been able to put forth. I do know that our COVID cases on Guam, the positivity cases, as well as our mortality, I believe it's at over 40% of these people diagnosed or have passed on because of COVID had diabetes. So that was a very alarming rate. So it was an issue that we needed to get that information on diabetes management and self-care across to our people. So I'm really grateful to the coalition, and the timing was impeccable that I came on board at the right time. I was able to have access to the information. I'm grateful to the coalition for being available at every given moment and able to answer questions and give me resources that I can pass on. So with regards to being a coalition member, I'm really happy to be on board. And I know this past several months, I've worked alongside Bound Pacific and had access to all of you. So I'm grateful for that too, in helping me spread the word. And as I said, my initial reason for volunteering is just ensuring that our people have access to healthcare and improving people's quality of life. So thank you.
Well, thank you very, very much. We appreciate that, Kathy. Healthcare takes many forms and many shapes, and it's amazing in our territories. And nice that you guys could present today from Guam. We also have a member here from the Saipan Coalition, and we're in American Samoa also. So we hope to hear from all of them in the near future. But right now, we're going to talk a little bit with Gina Rojas. Gina used to work with us in the previous scope of work, another wonderful human being down there in Guam. And we're going to talk to us today about the Patient and Family Advisory Council.
Tough day, everybody. It's nice to see some familiar faces.
Hey, there she is.
Wow. Yeah, I guess Agnes and Linus won't let me get away. Excuse some background noise. They actually invited me to join their group late in October. Hold on one second. Dog's going crazy. And I'm really pleased that this organization actually started to become active. Like I said, I joined a little bit late, so I had to do a little bit of catch up. But when I did, I was really happy to hear that that there was a group of volunteers who wanted to step up and provide additional services to our community with regards to their healthcare and that. So when I joined, there really wasn't a good focus on what the purpose of this organization was for me. So I had to do a little bit of research and a little bit of asking questions. And so the first step for me was to figure out what's our purpose and what are our goals here as our the advisory council. So I do a little bit of graphics, so created a logo to give us a little bit of identity to help separate us from the other organizations on Guam who are related to healthcare, and then decide what our vision is, what our purpose is, and what types of materials we're going to be providing to the community. One of the first things that we did was set our priorities and what kind of messages we will be sending out. And the group decided that the first thing would be access to care, being the center or expert of your healthcare. So we wanted to focus on ways to empower folks with easy ways, easily understandable and consumable ways on good healthcare habits. We kind of furthered that into creating a series. So you'll see that a little bit later, but our first series will be the expert of your care. And we will be touching on topics such as how to prepare for your appointment, medication education. And I'm glad that there's a guidebook available to us now that we can share to folks, because I think that's very important, understanding what types of medications are in your treatment plan and how to use them appropriately. We also will be talking about access to care. The next series will be on access to care with telehealth, Care transition is another topic. So at this point, I think we're just organizing what our thoughts are going to be, what series we're going to start with as a priority, and figuring out what our frequency will be. Is it quarterly? Is it monthly? The other thing that we addressed was what kind of resources are available to us. So because we couldn't do a lot of in-person or direct contact with the community, we understood that we have social media available to us. So a lot of our messages will be issued and shared through Facebook. We have a page that's already established. We will be working on the Instagram. We will be using WhatsApp, which is very popular here for social media messaging. And we want to keep it, the messages concise, easy to understand for those who are outside of the clinical arena, easy for a patient to share with their family, because I think that's important that they also understand what the treatment is and the treatment plans are. I think a lot of what our messages will be are going to be content driven. So the members and volunteers in the advisory council, that's the key role that they will be playing, is to help provide what the content of these messages will be. So I think in the next slide, these are just drafts. We've already revised these a couple of times, but we know that a visual is important. We want to provide information that they can keep with them on their phones or save with them on their mobile devices, so it's easily accessible. Like I said, these are just, looks like the formatting is a little bit off, but this is the first in the series of the first series, Be the Expert of Your Care, and it was important to establish a primary care provider, and that will be the very first step. And then we have a series of steps that we will be sharing on Facebook. And then we also are creating companion conversation pieces, which will be tidbit follow-up pieces to these larger flyer pieces. It's been fun. It's been challenging. I think that, like I said, the group is really key to what types of messages that the community needs to hear. We also want to be sure that we can engage the community. So if they have questions, and maybe this is a good question for the other coalitions, is how do you communicate and engage with the community? Do you have a separate email, a designated email that they can send to? We know that there are privacy issues with posting questions on social media. So is that a recommendation that we should make, is to send any questions to us by email instead of social posting? So we have a list of questions and challenges that I think that that we're still working on. Work in progress.
We are so blessed to have Gina. I mean, she put a lot of direction and organization into our PFAC, and it was just. I'm so glad we invited her. And no pressure. We told her no pressure to join, but please do. And we are so lucky to have her, and also the talent. This is a great logo. Like I said, she was the one that developed the Diabetes Coalition logo, as well as this one. So thank you, Gina.
Thank you, Gina.
Very welcome. Happy to be here.
Can we have the next slide, Mark? I think that's the logo for the PFAC. There. Yeah. So Alona said I told them to follow us on our Facebook page, but Gina, can you share the link to that? And we have about 26 people who liked it. What I did was I invited a lot of my Facebook friends. I think I sent over 100 invites. So and Gina was surprised. So we have people now liking our Facebook page. I said, those are my friends.
Yeah, and we didn't have anything on it. Except
Nothing yet.
Nothing was on it.
So thank you very much, everybody. Si Diyos maasi, and we're so happy and honored to be presenting our Diabetes Coalition work and our Guam Patient Family Advisory Council. Thank you, Gina and Kathy and Aggie, for joining me. Thank you, everyone. Thank you, Mark.
Thank you, guys. What a terrific job. Fabulous. Okay, we have some updates and events from Mountain Pacific. Tomorrow is a nursing home TikTok call. We also are doing a regional chronic disease learning and action network, rolling out the first quarter of 2021. And we do have a link here to our calendar, which lists all the different events that we have going on a regular basis on our website. We also have a couple of polling questions we would like to work our way through. And these were based, I think, before, and there they are. So if we could go through this, what types of activities would you like to see in the upcoming year? Select all that apply. Networking and sharing calls. What a great thing. Town hall discussions lead the way. We're very interested in spending a lot more time on networking and discussions. That's something we should take up more in the future. We've kind of given that some thought about maybe could we come up with different content areas and then break out into rooms on Zoom where the people who wanted to discuss those types of content could come together. Town hall discussion, definitely about all the stuff that's going on. Obviously, vaccinations, vaccine supply, distribution, trying to understand, as we all started in the beginning here, of how do you get in line? How do you get a shot? Mythbusters, we're seeing that to be a real big deal with our coalition meetings here in Hawaii, which is why in many cases that staff and vaccination rates around 50%, trying to find ways to help deal with the misinformation out there about a lot of these different shots. Great. Great. We'll be following up with both of those for sure, and the Mythbusters open Q&A. Okay, we got one more coming up, Mary. What target audience do you need the most help with? One is healthcare workers, A is healthcare workers, B is general public, and C is both.
This is kind of attributed to the vaccine uptake and things like that too. So kind of be thinking of that.
Okay, looks like we're at about 99% there, Mary. Pretty well spread out there, but we definitely need to work in both of those areas with the vaccination here going forward if we want to reach this level of immunity that will allow us to get a little bit more back to economic as well as public health normalcy. Thanks, Mary. Okay, let's move on. I want to thank everybody. We really do appreciate all of you for attending and being part of this group. We're going to open it up right now for a little bit for questions and answers. Does anybody have any questions out there? Looks like Sarah has put in the chat that two of our colleagues, Dr. Kunzweiler and Tony King, who is a pharmacist, Dr. Kunzweiler is the medical director for Mountain Pacific, will be doing an AARP town hall. Details can follow for posting and participation by those who are interested. They'll be addressing myths as part of their presentations. Another question, how many of our coalition members have received both vaccinations? Sarah's also talked about, love the breakout idea. How can we brainstorm on how to bust those myths? Crickets, crickets.
We definitely saw that too. And one of the other calls that I've seen is just messaging or education to general public that even regardless of the vaccine rollout, that we still need to be doing our part in masking up because we can still get COVID even after our first vaccine. So, and I think there's some misunderstanding out there still about that. So
Yeah, we've even seen a little bit of double masking, Alana.
mhm.
Yeah,
Yep.
so there I've seen people even getting more involved, and like you said, there are some getting less involved. Yeah.
Yep.
Okay, well, we want to thank you all again very much. Somebody got something?
Sorry, this is Gina.
Okay.
Just to follow up to the second doses, my aunt who's in her 80s has had her 2 doses of Pfizer. And in both times they gave us a QR code that links to the CDC follow-up after they get their dose for any symptoms or side effects. And again, I think that somebody mentioned earlier that there is a challenge with seniors and technology. If you don't have a smartphone or a device, there's no way that you can do your daily check-ins for your feedback. So I think that was one of the challenges that I didn't understand when I took her. If I wasn't there as her representative to do it for her, it would be very difficult to do that.
Yeah, the technology has been a real issue, particularly since most of us are looking at 75 and older, and horror stories about refreshing, sitting there for hours trying to get in and get things done so that you could even set an appointment. And you're right, it's as if we've chosen a vulnerable population, but they're also vulnerable when it comes to technology. And it doesn't look like we were prepared for that right off the get. Anybody else? We can give you a couple of minutes back to your day. Thank you all so much. We are proud of all of our coalitions across the Mountain Pacific region. We look forward to these meetings, and we're hoping that in the future, we'll be doing a lot more breakouts, a lot more discussion, as you said, and we'll need that to be driven by most of you. Come up with the ideas that you'd like to hear about from other members in other states and other territories. We stretch all the way from the Asian areas all the way to the Wyoming. And so we're quite a big, quite a large, got to be the largest region QIO in the country. So we have lots of ideas, lots of different disparity, diversity, and we'd love to bring that out so that we could all share it and do better. So thank you all very much.
Thanks, everybody.
Yeah.
Thanks, everyone.
Be safe.
Thank you.
Great job.
Bye, everyone.
Bye.
Keep doing up good work. Thanks, Agnes, Glynis.
Thanks, Mary. Congratulations.
Agnes, Glynis, can you hang on for just a little bit?
Okay.
Sure.
Great.
Bye, Mark. Bye, Sarah.
Bye-bye. Bye, Gina. So nice to see you.
You too. Take care.
Yeah, great.